Welcome to our presentation. We are Louisa, Tao, Sam, and Anna, and we're going to present our scenario 1.
In Mr. Lefau's scenario, 6 issues were identified. Firstly, staff have differing views on how to best manage Mr. Lefau's symptoms and behavior. Nurse Anna's suggestion to use chemical and physical restraint to manage Mr. Lefau's behavior will make him more confused the next day, increasing his risk of falls and accidents. It compromises on nursing code of ethics, autonomy, and beneficence. Secondly, a shift from an environment that is familiar to a medical ward in a city with changing staff and patients may cause distress and loneliness. This may be the cause for his attempt to have one-way conversation with other patients. Thirdly, Mr. Lefau is of Samoan descent. Therefore, in this scenario, it is unclear if he can communicate in English. Cultural factors such as family, ties, and religion may be important health factors that need to be included in his care. The fourth issue that can be identified is all patients in the medical ward have the right to control their personal space and privacy. Mr. Lefau's wandering behavior is disruptive to other sick patients and busy staff. The fifth issue identified is that Mr. Lefau does not know his diagnosis. Secondary causes for his symptoms such as urinary tract infection, stroke, poor hearing, and vision should all be excluded. The sixth issue identified is that Mr. Lefau is vulnerable to being dehumanized due to his frequent confusion and other symptoms.
So when we look into the ethical considerations of Mr. Lefau's treatment, it's also important to look into the reasons and triggers behind his state of confusion. He has a recent history of confusion, sleeplessness, forgetfulness, and a diminished attention span that worsens at night. He also has no current diagnosis. He has an acute state of confusion, which is also known as delirium, but this could also be caused by dementia, which is a chronic disorder of the mental processes caused by disease or brain injury. States of confusion and delirium can be caused by factors such as dehydration, polypharmacy, malnutrition, acute illness, or trauma. And older people with dementia or delirium in the ward are more likely to experience pain, thirst, fear, overstimulation, possibly because they have a diminished ability to communicate. Disruptive or unusual behavior can increase in cases of dementia at night, and also known as sundowning. And the nurse's idea to sedate him may worsen his confusion. Because her idea to use the sedative at night to control his behavior conflicts with the idea that restraint should not be used for convenience's sake, that misuse of medication in this way might be considered physical abuse. And because the pathophysiology of delirium is often complex and multidimensional, it stands to reason that the solution to Mr. Lefau's nighttime wandering will not be solved by physical and chemical restraint.
Contextual. The reason behind any hospital is to provide continuous care to all sick persons across a 24-hour day period. The responsibility lies and remains with the nursing staff, to which they should be performing at their best at all times, despite the increasing stressful conditions related to the direct care of the patient within the clinical setting. This should apply to everyone admitted as a patient, including Mr. Lefau and his situation. It will be important to see how nurses handle their patient load, which can include a range of patients and how patient outcome can be affected, as there is limited literature around how staff achieve quality patient outcomes. The many generations of nursing that is growing, each nurse has differing ideas, values, and beliefs. It may dictate the care Mr. Lefau is given between the older generation compared to the newly graduated nurses. Older nursing staff view the younger generation as overly mobile and lack of commitment. So this may cause conflict and may be present among staff, which can affect patient engagement rather than giving Mr. Lefau an option in his care. For all ethnic minority patients, it is pivotal that being culturally appropriate towards ethnic minority group is present, and it is important how supportive staff are to Mr. Lefau. Culturally diverse may result in language barrier, as it is unknown if Mr. Lefau can speak or understand English. Ethnic minority groups emphasize the meaning of being cared for, meant caring for each other within cultural, religious, and community contexts. It would be helpful to ask Mr. Lefau if he has family or close relatives to provide relevant information or for interpretation purposes.
Policies. New Zealand's restraint minimisation and safe practice standards are outlined by Health and Disability Services as well as DHB policies. New Zealand's best practice standard states that restraint is a serious intervention of last resort, requiring robust clinical justification. Therefore, Anna's suggestion to restrain Mr. Lefau by putting the rail guards on his bed up and strapping his arm to the rail guards does not adhere to the principles of least restrictive practice. It does not uphold the rights, safety, and dignity of Mr. Lafau. The clinical justification did not consider alternative methods, and this form of environmental restraint does not maintain the safety of Mr. Lafau. Nurse Anna also suggests for the prescribing of strong sedative for Mr. Lafau to be administered at night to keep him quiet and give everyone a break. However, all medicine should be prescribed and used for valid therapeutic indications. Use of medication as a form of chemical restraint is in breach of NZS 8134.2.
So coming to laws, there are 5 key laws that we found relevant to the case of Mr. Lafau. The first one is the Health Practitioner Competence Assurance Act 2003, stating the scope of practice of the health practitioner, and in this case, it would be that RN Anna is not qualified to prescribe any medications, specifically sedatives. And the Act also established Health and Disability Commissioner, an authority to receive and deal with complaints from the public. The next one is Human Rights Act 1993, and for Mr. Lafau, he is vulnerable because of his solemn, decent, and being an elderly with downgrading cognitive ability. So under this act, he is protected from racial disharmony, discrimination in healthcare services, and any other indirect discrimination. There are also relevant key laws in the Health and Disability Service Act 2001 and its subsequent Health and Disability Service Standard 2008. As you can see, the 2 main things that we point out in here are the Health and Disability Service Core Standards from 3 to 9, stating that he has the right for respect, the right to be recognized with specific values and belief, the right to receive culturally safe practice, good practice, and also the right to have effective communication. The Health and Disability Service of Restraint and Minimization and Safe Practice Standard in 2018, stating also the purpose of the restraint, the minimization of restraint, and also assessment before conducting any restraint, and restraint should be used safely. So coming to the Code of Health and Disability Services Consumer Right 1996, the key applicable rights for the case are rights 1 to 5, and also the 8th right. And finally is the Protection of Personal and Property Rights Act 1988. And in section 98 and 98A, the enduring power of attorney for personal care and welfare protection is stated. So in the case of Mr. Lafau, as he is a vulnerable adult with impaired mental state and capability, he is entitled to activate the enduring power of attorney, who has the responsibility to care and advocate for his well-being, and also the EPOA can participate in the discussion and care planning with other health professionals as well.
So there are a number of ethical justifications that we might be able to use to resolve this dilemma. Cultural safety means that as Mr. Lafau is Samoan, it's important to be aware of his cultural needs while caring for him, as well as the power dynamic between the nurse and the patient. Consequentialism means Mr. Lafau's autonomous wishes come into conflict with our concern to cause no harm to the other patients, and when Mr. Lafau rummages around the other patients' bedside cabinets at night, he disrupts the sleep of the very sick patients in the medical ward. Deontology means that a single rule or intervention cannot be applied to all of the situations, as Mr. Lafau's wandering and disruptive behavior is observed only at night, and this can be a result of sundowning effects. Casuistry means that certain research has reflected that constant surveillance or a watch should be allocated for patients with confusion due to the likelihood of wandering, and that reorientation strategies and caring human interaction should be put in place in Mr. Lafau's case.
For virtual ethics, is the nurse purpose to do good and perform to 10 standards of kindness in the nurse-patient relationship, and the ethic of care requires nurses to look at the patients she needs to care about Mr. Leval's Salmon backgrounds and establish therapeutic relationship with him and his family. For the principle approach, benefits and adhering to the principle of least restrictive practice and upholding patient rights, safety, and dignity with evidence-based clinical intervention, non-maleficence, doing no harm is a physical and chemical restraint will cause harm and restrain the patient may prevent them from seeking help or being taken seriously. And the principle of autonomy states that ensure the healthcare provider interest does not compromise the care and adequate patient empowerment where possible. Involvement with family and friends will advocate for Mr. Leval if his decision making is compromised.
For step 4, through consultation with a healthcare professional, duty of care was highlighted important where Mr. Leval should be placed in a single room, where a watch should be allocated in place that respects both his autonomy and maintain the safety for both staff, himself, and also other patients. The involvement of Pacifica Health Services to have a better understanding of the care that is needed to provide Mr. Leval with good quality care. And Mr. Leval should be treated equally and fairly as any other patient in a dignified way. Staff need to be aware of ethical rights that patients are entitled to. Identifying the ethical dilemma does exist due to 1, conflict in rights between Mr. Leval and other patients, and 2, no solution can completely satisfy all ethical principles.
There are a number of guidelines that fit into what we may be able to do and what also coincides with the Nursing Code of Conduct. Partnership means working with Mr. Leval and his family in his own care planning and the implementation of that care. Respect means we're respecting Mr. Leval's cultural and religious needs, and that he needs to be treated with respect and courtesy. We need to look for meaning behind his behavior and to try and understand how he feels and how to make him feel valued for who he is. There needs to be trust, so the nurse must connect with the people in order for them to be trusted, because it's a very important asset for nurses to have. Trust is something that's earned, and Mr. Leval, the management of how he's cared for is crucial to building trust in his therapeutic relationship. And integrity means that it's the nurse's job to act with integrity and protect Mr. Leval from harm and exploitation. This means that the nurse should not be acting in any way to gain personal benefit in a situation, such as Nurse Anna's idea to sedate and restrain him in order to make life easier on the ward.
So for step 7, we would like to involve not only the MDT health professionals, but also non-clinical staff. So the most important issues in here is Mr. Leval hasn't got any diagnosis with his downgrading mental health. So it's important that the doctor can give him the diagnosis as soon as possible. Nurses, clinical specialist nurses like geriatric or pain management nurses should also be involved to assess his delirium, confusions, and his wandering patterns to understand why is it happening, and any intervention should be suitable to improve it. Diversional therapists can also be involved to distract him from interrupting the routine of privacy of other patients. Same as occupational therapists, nutritionists, and social workers, and to make sure that we can deliver a cultural safe practice, we should also involve the Samoan healthcare specialist and interpreter in case he's not fluent in English, and healthcare assistant is there to monitor him throughout the whole day to keep him safe from harming himself and harming others. And for the non-clinical staff, like cleaner, kitchen, and laundry staff, it's important for them to be aware of the state of Mr. Leval.
We identified 9 actions and they are presented on the slide. Nurse Brett can communicate with Nurse Anna directly, or he can speak with the charge nurse to increase Nurse Anna's understanding of policies and evidence-based practice. Individually tailored non-pharmacological approaches should be considered the first-line therapy before using pharmacological effects for confusion. His wandering behavior requires increased supervision provided by staff, family, or friends. Family can also know Mr. Lefau well enough to know how he would like to be treated and what health decisions he would like made if he is not completely oriented. Diversion therapies such as pet therapy, exercise, reminiscent therapy, or interpreting reality intervention can be used to reduce confusion by reminiscing about their past, familiar face, or a favorite time of their lives. This may help link the resident to their reality and establish a routine and reduce confusion. If the family isn't available, someone healthcare assistant can be used along with the healthcare staff. The healthcare assistant can also be educated on diversional therapies and appropriate interventions when providing care to Mr. Lefau.
So there were two challenges present in the case of devising action for Mr. Lefau. The immediate issue of how to manage his care and his behavior while on the night shift, and his lack of diagnosis and treatment. And as such, there are multiple actions that should be taken. After reviewing the preceding steps, it becomes clear that there is no justification for RN Anna's solution of restraint and sedation because of the harm it could cause Mr. Lefau and its nature as bad practice. We need to be able to monitor Mr. Lefau during the night and employ distraction techniques. We need to employ techniques such as reorientation, and it's important that Mr. Lefau receive a comprehensive geriatric assessment in order to narrow down what might be going on with him, as hospital-acquired dementia and dementia on the ward can cause devastating effects and a further worsening of cognitive function.
So how can we put this into action? First, the healthcare assistant or nurse should be placed with Mr. Lefau to watch and monitor his behavior and safety using diversional techniques and reorientation. Mr. Lefau should also be evaluated in order to get a better understanding of his physiological and neurological symptoms. Delirium care should also be provided based on information applied during his assessment, and reassessment should be done to check for the needs of monitoring. Education and training should be provided to Nurse Anna about the patient rights and autonomy. Given the worsening state of Mr. Lefau's confusion and its potential damages to not only him but also to other patients, it's vital to evaluate the effectiveness of all the interventions. So first, staff competency assessment should be done, and to see if there's a need for further support or education for their staff. Like, for example, Anna, daily documentation should be clear and detailed about his alert level, pattern of his wandering behavior at nighttime, evaluation of deep line distraction techniques, and input from the family. And for sure, diagnosis and review should be done weekly by the MDT and daily with the Dr. Rao. The communication within the team should be open and allows feedbacks from family, HCA, diversional therapists, as well as any other health professionals that involved in the care for the effectiveness of the interventions. So that should close our presentation. Thank you.